I'm Dr. Rick Steinberg. We're here to talk today about attention deficit hyperactivity disorder. This talk was originally designed as a talk for parents who are about to have their child evaluated for this condition. And if you're going to have an intelligent conversation with your physician about whether or not your child has ADHD, you need to have a good understanding of what we're talking about by this term, what this condition looks like, how it changes over time, why we treat it the way we do, and why that treatment is so successful. If you have a full understanding of ADHD, you can have a much better conversation with your doctor about whether or not it affects your child. ADHD is a common condition. We used to think it impacted between 3 and 5% of the school-age population. That is an enormous number of children, but that number is wrong. The actual number is 8 to 10% of the population. And I'm not saying children anymore, because this is something that we know now impacts people of all ages. 8 to 10% of children are well identified. The number of adults is about half that number, not because it somehow goes away, but because this number of symptoms of ADHD will diminish below the threshold, but you may still have significant impairment, profound impairment in some cases, from the remaining symptoms. This is an important condition. It's a condition that affects millions of American families. It impacts almost every classroom in America. It's a condition, if recognized and if managed appropriately, has the potential of enriching your life. But if you ignore it, it can make your childhood difficult, it can make your adolescence dangerous, and it can cause an impairment at every stage of adult life. Now, the traditional definition of ADHD is based on the findings in the DSM. The DSM is the Diagnostic and Statistical Manual. It has lists of symptoms and criteria for all of the psychiatric and behavioral conditions that we know. It's a collection of symptoms that have been decided upon by various experts. And the way that the DSM defines attentional deficit disorder is along two particular behavioral parameters. One of those parameters is that of attentional focus. The other parameter is that of overactivity and impulse control. Some children will have difficulties in only one of those two parameters, and if they do, we use a different term for them. We'll talk about inattentive ADHD or hyperactive ADHD, or if they have both parameters, we call it combined type ADHD. In recent years, it's become increasingly apparent that however you may label your ADHD child, inattentive, hyperactive, or combined, that particular description doesn't last forever, and these children change over time so that different parameters become dominant, and we don't use that terminology very much anymore. But attentional deficit hyperactivity disorder includes difficulties with attentional focus. Attentional focus refers to the ability to pay attention to the right thing with the right intensity for the right length of time, and then at the appropriate moment to change your focus to the next correct topic with the right intensity for the right length of time. All of this is subsumed under that term attentional focus, and children with ADHD will have difficulty with one or several or all of those features. These are children who will appear to be somewhat inattentive. They get distracted easily. They have difficulty staying on task. They may have difficulties to start things, especially things that require some focus and concentration. They have difficulty finishing things all the way to the last step. These kids are forgetful. They'll start something and they'll forget to finish it. They'll start their homework, they'll do 3 out of the 10 math problems, and then they get distracted by the dog barking, and when the dog stops barking, they forget to go back and finish their homework. And if they do go back and finish their homework, they may forget to pack it up to take it to school the next day. And if they do remember to take it to school the next day, they may forget to give it to the teacher. All of these things are part of that attentional focus difficulty that so many of our ADHD children struggle with. The second parameter is that of overactivity and difficulties with impulse control. Overactivity is one of those situations that's difficult to define but easy to recognize. These children are active, they're on the go, they're driven by a motor, they're constantly fidgeting, constantly restless, constantly moving, constantly talking. And if you ask them to sit down and be quiet, they will be for about 30 seconds. Then you'll see them begin to fidget and move again and start talking, and they're right back to their usual state. Impulse control refers to that ability to take those few milliseconds, that tiny fraction of a second that we need to do to consider what you're about to do or say and make sure that it's not something that's going to sabotage your best interest, it's not going to work to your best advantage. Let me give you an example of typical impulse control issues. It's a rainy Saturday afternoon. You're sitting in the living room reading a magazine. Your two children are playing on the floor in front of you. There's 4-year-old Mary. She's playing with her dolls and teddy bears. She's having a little tea party for her teddy bears. She's serving a nice, well-brewed Darjeeling to Miss Panda. And then there's 7-year-old Billy. He's playing with his toy cars and trucks. He's driving them along imaginary roads and crashing them at intersections. As you watch this idyllic scene, you see Billy suddenly reach over and smack Mary upside the head. Of course, she comes running to you, and you ask the obvious question. Billy, why did you hit your sister? I don't know what he's going to say, but I can tell you the two things you're most likely to hear from him. He might say, she was bothering me. Now, you've been watching this scene for the last 5 minutes. She was having absolutely nothing to do with him. But then you have to think about it from Billy's perspective. Mary often does a lot of playful teasing of Billy, and Billy needs this teasing to feel present, to feel alive, to feel in the moment. And when that is missing, that was what was bothering him. He spoke the truth. The other thing he might say is, I don't know why I hit her. And that also is a true statement. This was an impulsive act. He wasn't sitting there thinking about it. He didn't sit there thinking, well, it's getting a little boring here. If I smack Mary, that'll make it exciting. And of course, Mom will send me to my room, but she's in a good mood. I'll only be there for a couple of minutes. And there's some toys I want to get from my room anyway. This is strictly a win-win situation for me. Smack. That never happened. This was an impulsive act. This was done without any kind of conscious forethought. These are the two basic parameters of ADHD. There are a few other minor qualifying factors, but basically this is how the DSM defines this condition. And if that were true, we would be done in a few minutes. But of course, there's more. One of the things that parents particularly are very aware of is how unpredictable this condition is. These are children who can spend 2 hours, solid hours, playing a video game, but if you ask them to go up and clean their room, they may go to their room, they may start cleaning it up, but within a minute or two it's there, oh, that's the toy I was looking for last week, and suddenly they're gone, happy as a clam, playing for the next 3 hours, but the room looks just progressively worse. Or take the classic homework situation. Every night the teacher assigns 10 to 15 minutes of homework, and every night it's the same thing. It's a 2 to 3 hour battle with yelling and crying and threats and recriminations. And I'm talking about the parents. The kids are even worse. This goes on night after night, every night, total misery. And then one day he comes home, hi Mom, spreads his books out on the table, whips through his homework, packs everything up, okay Mom, I'm going out to play, I'll be home for dinner, see you later. And you think, oh my God, he's finally got it. All of this misery, all of this suffering is now finally over. We're at the point where our family is going to live happily ever after. Don't believe it. Right after that, he's right back to it. The next day, he's right back to his usual. And that good day was just as random as some of his bad days. The only thing, by the way, that changes with that particular situation is you may find yourself yelling a new line in your nightly diatribe over homework. You're going to hear yourself shouting something along the line of, God damn it, why can't you do this? You did perfectly well on March 14, 2017. Why can't you do it again? But that is precisely the point. It's not that he won't do it again. It's that he can't do it again. This condition is pervasive. This in fact affects everything you say and do. It affects your home life, your school life, your friend life, your family life, your ride your bike life, go to the movies life, go to the beach life, play basketball life. It is part of who you are.